The Canadian Bovine Mastitis Research Network presents the ABC of milk sampling for bacterial testing. Bacterial testing is a diagnostic tool that is essential to any program designed to manage udder health within a dairy herd. Test results are useful to determine what bacteria are associated with clinical mastitis and subclinical infection cases found in a herd, to decide what treatment strategy and what preventive measures to adopt, to detect subclinical infection cases at the beginning of lactation, to determine the status of cows that have recently been purchased, and to confirm the bacteriological cure and the effectiveness of the treatment administered at dry-off or during lactation. Before beginning the milk sample collection procedure, prepare all the material you will need: teat dip solution, gloves, clean towels, alcohol pads, test tubes, a test tube rack if needed, permanent marker, ice, and a cooler. To make sure the results are reliable, you must proceed carefully using a sterile technique. After putting on gloves, wipe the teats with a clean towel. Draw a few streams of milk into a strip cup to reduce the number of bacteria in the teat canal. You should also check for the presence of abnormal milk in each of the four quarters. Then, disinfect the whole teat with a pad moistened with alcohol or an alcohol pad. When you disinfect the teats, make sure you finish with the one that is closest to you to avoid contamination from any contact with your wrist or sleeve. Pay particular attention to teat ends. Once you have completed disinfecting the teats, proceed with the sample collection. First, remove the cap from the tube by holding it with your little finger. Hold the cap so that the inside is facing toward the ground. Without letting the tube come into contact with the teat, draw some milk into the tube held almost horizontally to avoid contamination from manure or bedding particles. For a composite sample, draw the same amount of milk from each of the four quarters. Once you are done, put the cap back on while taking care not to contaminate the inside. Fill the tube to a maximum of 3/4. After the sample has been collected, it is important to dip the whole teat in a disinfectant solution that is approved by Health Canada. Using a permanent marker, record on the tube the date, cow ID, reason for sampling, and sampled quarter. Use a rack to hold the tubes if you need to collect several samples. To complete the process, you must chill the sample quickly by placing it on ice in the bottom of a cooler or in a refrigerator. Samples must be sent to the lab quickly. If that is not possible, freeze them immediately. A duly completed form must therefore be sent along with the milk samples. Bacterial testing is used to identify bacteria that are responsible for udder infections. It is undoubtedly an essential step for the implementation of effective preventive measures and the selection of appropriate treatment. Consult a veterinarian to set up a milk sampling protocol at the farm and to interpret test results.